Hello, SabinaBrennan here, host of the Superbrain podcast and author of Beating Brain Fog. I want to wish you all a happy International Women's Day. The theme this year, 2021, is to choose to challenge. I'm in. From challenge comes change, and I believe that big changes can happen when lots of people do little things. So, I want to tell you a little about the things that I want to challenge in order to forge a gender equal world and raise awareness against bias. As a health psychologist and a neuroscientist, I am passionate about empowering women to be more proactive about their brain health. I am also acutely aware that women are disproportionately affected by both brain fog and dementia. Visit my website and you will find tons of free resources about brain health and about dementia risk reduction. Many of them are in multiple languages, so feel free to use them and to share them to help empower women around the globe. Today, I want to talk about brain fog. If you Google brain fog, you'll get about 60 million hits in less than a second. But we all know that Googling is not the best thing to do when it comes to looking for health advice. So you'd be far better off visiting a government website like the NHS website. But the thing is, when you visit there, you will draw a complete blank. Nothing to be found about brain fog. And so many women have told me that then when they have expressed their concerns about brain fog to their own doctors, they didn't fare much better. So I wrote a book, Beating Brain Fog, to help women to understand their symptoms, to help them to identify potential underlying causes, and also to provide them with practical strategies and tips to help them to minimize and eradicate their brain fog. Now, I just want to briefly say that brain fog is not a diagnosis, it's not a disease, it's not a disorder. Rather, it is a sign or a symptom of an underlying health issue, a hormonal imbalance, a nutritional deficiency, or even the consequence of certain lifestyle choices. But brain fog can be extremely debilitating, affecting your quality of life, your ability to work, and even your relationships. I know I've lived through brain fog as a consequence of a health issue and also as a consequence of hormonal changes. My book also provides women with the tools to take to their doctor so that they can challenge their doctor to take their symptoms seriously. Doctors are more likely to look for organic causes when it comes to male patients. But when it comes to women, they are more likely to attribute their symptoms to psychological causes. And that is something that I would really, really like to change. The following is a short extract from my book. I can't help but think, and I could be wrong, that the fact that more women than men are affected by both brain fog and the many conditions that underlie it is part of the reason why little progress has been made in finding cures and treatment. Women have long suffered and continue to suffer as a consequence of gender bias in both health research and healthcare. Most of the medical knowledge that exists today is based on human and animal research that excluded women, despite the fact that men and women differ at a cellular level in ways that mean that diseases and treatments may affect women and men differently. When it comes to healthcare, women and men are not treated equally. Medical professionals behave differently towards women than men in terms of assessment, diagnosis, referral, and treatments. Women are more likely to be misdiagnosed than men. A study that looked at 770 diseases found that on average, women were diagnosed 4 years later than men. Misdiagnosis and delayed diagnosis happen frequently in autoimmune diseases, which affect 3 times more women than men. Even when women present with similar health problems to men, women are more likely to receive a lower quality of care than men. It's highly unlikely that this is intentional. It is far more likely to be the result of unconscious gender biases or stereotypical views by medical professionals. You and I must choose to challenge in order to bring about change and foster equality in health. I'm in. Happy International Women's Day.